name is Saima Gul. I'm from Pakistan. I'm in the country from last 2 years. Before coming here, I was working as an aid worker. I work in my country, in my area for more than 25 years as a development worker. I used to work with different international organization, national organization. Like my last job was with the World Health Organization as a communication officer at provincial level, where I worked on polio eradication program, where in Pakistan there are these pockets, especially and some ethnic group and religious group are against of the polio drop. So my role was to develop communication strategies and to support the campaign toward polio vaccination. So
Wow.
when I came, yes, so when I came here and everything was totally changed. And but luckily I got chance to work as a public advisor. It is something that very near to my heart, near to my passion, near to work that I was doing over there. So I'm really happy to be part of the intervention where can give my voice to researcher, to project, to learn from the academia person and researcher. And I'm hopeful that in the future I will be again able to continue same work here with the communities.
Oh, thank you. What amazing experience to be able to bring to the as a public advisor. That's amazing. So just so that people can kind of picture something that you might be involved in as a public advisor, can you think of an example of something that you were involved in as a public advisor?
As a public advisor, I got a lot of chance to learn and to give my feedback. Like as a Asian minority Muslim woman, there were lots of time, the space that what is the reaction or reflection on big data, on diabetes, on flu care, on de-stress, mental health things. So I was able to talk about my own experiences and the community member what they are thinking, and I gave my perspective, and I represented my community in the researches and in the projects and in these talks.
Okay, oh, that sounds really good. And how do you think, so that involved kind of like presentations and did that involve kind of researchers asking you one-to-one about your views about particular things?
The things were different in the different projects or in the different researches. Like some of them were requesting or asking uh, to to bring like some of the pictures, to bring some of the case studies, to bring some of the ongoing things. So I think I as I came in the time of COVID and everything was stopped and only the Zoom or the this kind of interaction was there. So it was a very good space where we brought the things in the presentation, in the discussion on the ongoing situations.
Okay. And so, Saima, thinking about all of those projects that you've been involved in with lots of different people, what do you think works well? So if I wanted your views on something, what as a researcher should I do? What works well?
I think as a newcomer in the country, or as a person who now here and need to be as a valuable member of the country, at least to utilize the strengths and the things that he or she want to do. So as I got this platform, but I think the way the especially ARC work with the public advisor to develop their capacity toward the work as a layperson, like though there are a lot of researchers or organization who are working, but they provided a space where we reflect many things. Like there are a public advisor forum which help us. There are ARC Fest that give us a very big perspective of the things going on. Then there are some event or things in which you have chance to go to do some practical things. Last time I was involved with this health equity and inequalities,
Oh,
one of the research where we were having our stall in the shopping area in the university, and we were talking with the teachers and students and the communities. So these were some things that were helping me to dig more and to have more understanding of the area, of the situation
mm.
or the needs. Though my own personal experience is also heard very good, but still I think the way they are taking us, it's very good.
So that sounds that sounds possibly broader than some of the activities that a lot of researchers will engage with public for, asking quite specific questions to develop something specific. But it sounds like it's really useful to have those broader kind of activities that's just generally thinking about the issues in a whole context kind of view.
Yes, I think you are very right. Like the researcher, when we got any chance to talk them through ARC, it's not necessary sometime that you saw something and you applied and the researcher take you.
Mm.
So this depend on them. Like they found 4 or 5 people and they will ultimately talk to they would like to talk the one who meet the criteria as per
Mm.
their demand or needs. But as a whole, the ARC themes or subcutting themes, they give you something that you bring your experience and the things that you want to give priorities at the other forum as well. So like there are some other activities with the name of human development network, that where we also had a chance to talk on such kind of thing beside the research. And when we talk with the researchers, it's a limited thing, like
Mm.
talking with their question and answer. And many times we didn't heard back from them.
Okay.
But the forums are in the other activities, we have the space to bring that kind of things again and again. So
Yeah.
we are also learning from the researchers and taking it back to the ARC.
And I think that's so important, isn't it? Because that's that ongoing conversation then. And I think sometimes just opening up a conversation without a particular, without something that you want out of it, but just having a conversation can be really, really useful, can't it?
Yeah, yeah, it is like sometime in some of the researches, you even don't know about that, like the artificial intelligence and
Mm.
its use in the GPs. It was something very new for me. So I was part of two of the researchers who were asking about, and this was something that like opened up many things in my mind, and it was something that when I was talking to my community and to the South Asian people, and they were like taking interest in that. So sometimes things are very like as well the social prescribing, as well the health equity and inequalities things that because each time when I talk to researchers, when I participate in the thing, I get more information, and it helped me a lot.
Oh, that's so nice. And I think listening to you, one of the things that we were keen to kind of learn from you about was advice that you would give to researchers about things not to do. And I know you just mentioned there coming and asking and then never letting someone know what's happened, never having contact again. So kind of coming in and asking some questions and then going away. Is there anything else when we are working with public advisors that we should avoid doing?
I know I understand the limitation of the researcher. As I told you, I was coming with a background where I was all the time involved with the community. There might be some researchers working on that, but it was different from here. But sometimes I feel like the things that is going on, a researcher should do some kind of applied research as well. Like come and see the situation, what we talked, and look it into the community, or definitely this will be different from Liverpool, because Fleetwood context is different, and I am talking for example about my own situation, my own area, the issues and the things. So sometimes I feel if there are some kind of applied research, you come and visit the community and dig more about the issue, that can be more effective. Or the researcher, if they come back to us, like they share their in 1.5 years of this experience, some of the researchers should completed their researches, but
Yeah.
I never heard from any of them that have this copy. This is something that we talked, and now it is in final stage. So this will I think in future, if we do such kind of things, or if there is something on ARC website, or in any resource where this, just send us a link and say, if you are interested, you go and see, and you will be happy to know more about. Or
I think that's kind of like it feels like it's either end of doing the research project in the middle, that the idea of spending time in the community at the beginning seems so important, but something that we don't always do. And then to carry out the project and then make sure that we take that back to the people that have helped along the way seems obvious, but not always something that happens, I wonder.
Yes, this is and one other thing, like when we talk, we are in the northwest coast, and when we see all the things are around the cities, when we see all the things are around the things which are in mainstream, the areas like Fleetwood, here I see less, or maybe it's my limitation. I'm not a working lady, but I'm trying to know more about the things. I can't see like this kind of feedback whenever I gave to the researcher. Did they talked about that? Like after 1.5 years, I think if I'm still working, then 2 or 3 people should contact me that we are coming to you with the feedback of Lucy because you talked so let's talk
Yeah.
more about that. So I think this will really help more to bring the voices and to strengthen the ongoing projects and researches.
Oh, that's a
Yeah.
really good point. And Simon, I'd be interested to hear what you thought. So if a researcher was to know that they need to reach out to communities that maybe haven't been as involved before, because we've not made the effort to go out into communities, where should they start? How do they find people within communities to kind of work with? How would they start if someone's newish to this role?
There are many ways, though when I see the cultural difference or things are very difficult from different from here.
Hmm.
Talking to people is not very easy. Like from the background where I am coming, like I was sharing this to the people that when I changed my house, I shifted to a new house. If
Mm.
it could in my own area, on the first day, from the shopkeeper, from the neighborhood, from the mosque, or you can say the church, they all there would be a list that they were becoming to the people, to the
Okay.
new person who entered in your community. But here, if you change your house for the other whole year, no one will bother. The next door will also not bother who you are. Why, when you shifted, do you need anything, any support? So this is the difference,
Mm.
and it's something difficult for us to take. Though people are very good people and kind-hearted, whenever you go around, they give you smile. All things are there, but they not open up. So
No.
in this kind of situation, it's something for researcher also, that from where to start.
Mm.
I myself took the whole 1 year to understand from where I start.
Mm.
Then I found the space through church,
Hmm.
through the elderly people. And then I came to know there are some network who have now I'm going to regularly with this monthly meeting of Healthier Fleetwood
Mm.
from last 4 months.
Hmm.
Like when I go there, and it was really very nice, where people are there and they are just sharing what they did in this month and what is their plans.
Hmm.
So this kind of space is very good, and from there I came to know that if you want to start something for your own, we are there to support you.
Mm.
So when I shared with them, I got 3 or 4 calls, and I told them, okay, stop. I just started with that. So these are some spaces that are there, but I took the whole year to understand this.
Yeah, that's just you've talked about that so well, in the fact that it takes time. It really takes time, and I think sometimes the nature of funding means that as researchers we kind of swoop in and try and kind of gain some quick feedback, but actually the best is that long-term kind of working relationship, isn't it? And yeah,
Yeah.
that you talk about that really nice, and that's really important, I guess. And I think having links with people in communities is probably is a good way to kind of start those conversations, maybe, do you think?
Um, Again, like it varies to the person. to their background or to many things like as myself was already working lady and I came here for the whole 1 year. I didn't saw any Asian in the nearby area residing here, and then I start almost like 5 months ago. I saw two Afghan refugees ladies, and then now they are four ladies. So now I want to say like I am going to attend the LDR Fleetwood. I am going to the library. I also identified this warm spaces where I sometimes when I go, I feel very good. But if someone want to work with migrant people and they expect that these people will be coming to the warm spaces to the healthier street food, no, it won't be able, because these ladies or even the men's, they are struggling a lot with this new system. The language problem, the education problem, the literacy, even these women were not, never went to the school. One of them never went to the school. So she is facing a lot of problem. And when I see as a couple their struggle, I see the men don't want to leave the lady in many things. Because he think that it is not good for her, but she need a lot of support. Now if someone want to work on this kind of ladies, and if they think that she or he will be coming to the mainstream, no. So you need to identify these women and then their problem, and then you need to go case by case, one to one. So sometime maybe I'm asking for too much, like it will take more time. But if you really want to know the real issues, you need to be more focused, and their things will be very different, like the migrant population problems and the struggle. Because when we see them in the area like Fleetwood, where there is no mosque, where there is no halal shops, so they are all the time in mental stress and many things. Though there are again some of the research in which myself luckily involved with the name of De-Stress Project, and which is a very something that's very near to my heart, which says the poverty related stress and the impact, and trying to talk to GP to not prescribe too many things, so bring them in the activities. So though I am taking that all things and I'm trying, but is there any researchers to see in all these, or research or community organization? So need to focus on them through community organization to identify, because in the mainstream these people will not come, and they can't tell you what the problem they are facing when they are going to GP without this language problem. And because here the organization or the support cannot be given on each step. The state is providing you money, like they told this is school, this is gym, go and enjoy or take your children, but it's my limitation, I can't do so. How to fill that gap,
Yeah, and that
because
can only sorry, go on.
Sorry, because lots of Afghan families are here. Lots of Afghan family. If you see the number after the Afghan this collapse of Kabul, lots are there. But are you managing them only with the money? No, this is not only needed. You need to do more. If you are sending them in the areas like Fleetwood where the rent are low, but the other things will be very bad affecting on them. So
Yeah. And so that's so interesting, Simon. And I guess it's thinking about that trust and that relationships, isn't it, with people that you're working with, that takes that time. And it feels like a real rethink of the, you know, many of the ways that many researchers would practice. Yeah, that's it's really interesting. And I guess as a last kind of question, if you know, the work that you're doing is really amazing, what one thing do you think that would, how would we continue to make our public involvement better, do you think, within health research?
actually, as a working woman back to home and now being here, a lot of cultural difference, a lot of pressure on ourselves, even on me, to
Mm.
to come with the level where system own me. So lots of things, this apply at every level, like on the women who are coming to this country and now part of the system, they have children, like these four women, all of them are having three children. Two of them are pregnant because
Mm.
in our culture, five children are normal thing, like very normal. So they will be five plus, they will be having in their life. So it's a big thing, like we need to evolve with something. Specifically, I'm asking to this community, um, where their problems can be understand on regular basis, like not only for a research and then finish, or research and then finish. No, like you make them a research point and go on.
Mm-hmm.
You're getting my point,
Yeah.
like because this if some researcher are working with the marginalized group, so with the marginalized group, not only one issue like social prescribing, like COVID impact, like education, like immunization. So if you take me and you just see all these things, you
Mm-hmm.
will be like don't be short, be wider, like
Yeah. Look
be connect.
broadly. Yeah.
Yeah.
So so it's kind of like investing time to look broadly, will it kind of identify the issues that you might not even have thought about within that particular field.
Yes, like yesterday I came to know when I was reading one of the newspaper where they said that because of delay in the ambulances, more than 500 deaths occurred, and they told this number can be double. And myself is the witness of this. One of the
Mm.
Syrian family who lives here, only 49 years husband died in 2 hours because he got a heart problem. By the time the ladies understand and she called, and when the ambulance come, the person expired.
Mm.
But if it happened in my area, like if someone have this heart attack,
Mm.
we know what to do. We
Mm-hmm.
are just away one call, car will come, and
Yeah,
we know where to take him. Here, the system is so complicated. A big system,
it
a
is.
very nice hospital with everything, but a person lost his life.
Mm. Yeah.
Why, like how it can be possible with a heart attack, and the woman is still crying, and she said my husband was very okay, what happened, how it can be. So it's for me it was something very like to I want to bring this question to all the
Mm-hmm.
NHS people. Like behind my house, the Mount View Hospital, a very big building, but you can't go for everything to there because a system is involved. You have to call. If you go without call, they will not treat you. You see the people who has this problem. You don't wait for the call. Like,
No, it's
yeah,
it's kind of flipping the way, Saima, rather than researchers coming and saying, we want to do this study, what do you think about it? But you being able, the community's being able to go and say, look, this is an issue, we want you to research it. That would be
yeah,
where we should be going, I think, isn't it?
yeah, yeah.
Yeah.
Really, really, I really want this thing.
Thank you. That's a really, really interesting interview, Saima. I could talk to you for much longer. We're trying to keep the interviews kind of quite shortish. So I'm going to say thank you very much.
Yeah,
And I hope people learn lots from listening to the interview. It's really made me think about a few things. So I really appreciate your time.